Hi, this is Dr. Farley. I want to go over with you the basic testing that we're going to be doing. Either my staff or the treatment doctor does all the testing here, and we run through various different tests so we can start off measuring function, knowing where someone's functional level is. If your case qualifies and we're taking care of you, we then can go back in and do a couple re-examinations along the way to measure where you were, where you are, and we can track you much more accurately than only, hey, how do you feel? I want everyone to feel better as soon as possible, but we also want to know objectively that your testing and your function is getting better. So this piece of equipment right here is called an NSI. It's a functional brain-based testing machine, and there's 7 different measurements that we measure here. The first one is proactive parameters. Go ahead, Doc.
Okay.
So the doc will be sitting here, the machine is going to start working, and she's going to start running through the test. This machine specifically here is measuring your temporal lobe, your parietal lobe, frontal lobe, cerebellum, and superior colliculus. Okay?
Okay.
You can stop. Next one is going to be tracking. With this one here, we're going to have you following an object with your eyes. This measures your parietal lobe and your cerebellum. And again, this is a very easy test to measure, treat, and retest again. Sometimes we use these pieces of equipment as actually treatments if we need to. Okay? Next one is going to be saccades. This test here measures your frontal lobe, cerebellum, and superior colliculus. Good. Fourth test is called your tachistoscope. A lot of people have trouble with this test because a lot of people are having frontal lobe breakdown. If there's any signs of memory issues, temporal lobe, frontal lobe are big ones. Stress issues also. Go ahead. So this is going to be measuring the frontal lobe and the temporal lobe.
In sequence. Start, long, about, keep, grow.
And again, what the machine just did, you can hit pause. What the machine just asked was to find the words in the sequence that the machine just told you. So it's looking at a lot of different parameters. Next one is metronome. Go ahead. This measures the frontal lobe and cerebellum again. Again, the cerebellum is the key to the whole brain. If the cerebellum is breaking down, everything's breaking down. Go ahead. And this is a sound, and you're going to be following certain instructions based on the sound and tapping at the exact same time the machine is making the sound. Okay? Next one is optokinetics. This is done on the left and the right. And basically you can see the machine is moving. This measures your frontal lobe, parietal lobe, cerebellum, and your vestibular systems, which has a lot to do with your balance areas. Okay? And lastly is your visual motor. And what you're going to do with this is it's basically going to ask you to track with your finger. It measures your frontal lobe and your cerebellum again. Okay. So each one of these tests will be graded from profound deficit up to optimal function. Optimal function is 100. And then we break it down from there. So if we find one of the tests is weak, we know that those parts of the brain are weak, and over a time frame we may use this as part of the treatment, or we may do everything else that we're doing and just come back and reassess to say this is where you started and this is where you are over time. So there's one more measurement that we use to look at the functional neurology component of what we're doing. Thank you. Hi, this is Dr. Farley. I want to go over with you some of the diagnostic testing that we use here in the office. This is called an autonomic nervous system testing. You're going to get a full report like this. It'll explain in detail about the autonomic nervous system, and then we run the test on you. The test takes anywhere from 5 to 8 minutes. You sit here quietly, and basically what we're picking up here is heart rate variability through these little calipers here. And a few points that you should understand. The heart rate variability measures your autonomic nervous system. 90% of the output of the brain goes to the autonomic nervous system, and the more varied your heart rate is, the healthier your autonomic nervous system. If you go to PubMed and you type in heart rate variability, you're going to find 22,596 research articles published. So this technology has been used since the early 1960s to measure various health outcomes and parameters. My machine actually gives me 21 different measurements, and when we're all done, I will review these all and we'll have an idea of how your autonomic nervous system is working. But it's a very accurate way to look at the 90% output of the brain. We want to see how this autonomic nervous system is working. The autonomic nervous system runs all your hormones. It runs sex hormones, thyroid, adrenal hormones, all the hormones. Runs the gastrointestinal system. The heart delivers the lungs. It runs the musculoskeletal system. It has a lot to do with your neurotransmitters. Has a lot to do with your stress response. A lot to do with your immune function. So we get a measurement here, and then we can start to objectify what your basic starting point is with your autonomic testing. Thank you. Hi, this is Dr. Farley. I want to go over another piece of equipment called bioimpedance analysis. This is probably one of the newest pieces of equipment that I've gotten into the clinic here to measure function. Everything that we do here is to try to measure how your body's working. We do not depend upon how do you feel only. Of course, we want everyone to feel better as soon as possible, but we also want to be able to measure objectively where was your health, where is your health, and are we moving in the right direction. So body composition prediction using bioimpedance analysis is a key factor for the evaluation of a general health status of humans. There's a tremendous amount of research on this. We're measuring intracellular water, extracellular water, total body water, and we're also getting something called your phase angle. The piece of equipment has been used to measure cancer patients, and they're tracking cancer patients to look at the growth dynamics to differentiate an aggressive cancer cell versus a benign cell. They're using this a lot with breast density to look at younger girls and their risk for breast cancer over time because they don't want to start radiating a young breast. And it's been used since the 1970s, and it has many different uses, and the results are reproducible and rapidly obtained. And mainly, when we give this to you, you're going to get a report, and in that report, there's going to be some key components here. We're going to be measuring your intracellular water. We want to see this, that the higher is better. Extracellular water, less is better. Total body water. And we also want to get something, and probably the most important thing that I look at on here is what's called your phase angle. So this is a sensitive indicator and predictor of total health. Your phase angle measures the strength and resiliency of the cell membrane itself. And 3 major studies released in the last 5 years have shown phase angle to be more accurate and sensitive indicator of long-term prognosis for patients with AIDS, cancer, and kidney disease. A higher number, the better. So you're going to have these sensors here, and you're going to have these sensors here. You sit for a few minutes, and the machine does its running. It will give us the analysis, and we will combine it all together and tell you what it all means and looking at your overall health picture. Thank you. This is Dr. Farley. I want to go over another piece of equipment that we use here to objectively measure your overall health and functional levels. You see this little device here. It's a fancy name. It's called plethysmography, or we call it an Angioscan. And basically what this does, it gives us a lot of information on various different components and how your cardiovascular system is working. It is not used to diagnose disease. It's used to measure cardiovascular fitness and overall function, but some of the key areas that you want to know. It's a promising technology due to its simplicity, low cost, and non-invasiveness. It has potential for early screenings for various atherosclerotic, which means heart, pathologies, and could be useful for regular general practitioner type assessments. The clinical applications, it's been used in various different clinical settings, but it can include clinical physiological monitoring of blood oxygen saturation, how much oxygen you have inside your system, heart rate, blood pressure, cardiac output, and respiration. It assesses the vascular system for arterial disease, arterial compliance, and your overall vascular aging. It also looks at your microvascular, blood flow, and tissue viability. It looks at your autonomic nervous system, which looks at vasomotor function, thermoregulation, which is temperature control, blood pressure, and heart rate variability. It also looks at your orthostatic intolerance. That's the ability of your blood pressure to move up and down as you need it over time. If you're having trouble with that, you could feel weakness or dizziness when you stand up or move around. There's neurological applications and cardiovascular variability assessments. So each of these has a very good clinical use, and over time we will give you a report, and in that report you're going to get a little sheet explaining some of this. But there's 6 different measurements that we get. We get your heart rate, we get your vascular stiffness. We want to see a negative number here. We want to see no vascular stiffness over time. We're also going to get your pulse curve type for your age. We're going to get your vascular aging. What's the aging of your entire cardiovascular system, which has a lot to do with the heart and the brain. Your stress index overall. What's the stress response inside your body? We're going to measure the hypothalamus pituitary adrenal axis through this machine. And then lastly is your oxygen saturation. If we're talking about optimal brain function and optimal health, we want this to be near 99%. So we're going to get all that information, and we'll be able to review this with you and show you how this piece of equipment has demonstrated their good or bad functional outcome. Thank you. Hi, this is Dr. Farley. Another component that we're going to be measuring is cerebellar testing. The cerebellum is the back and the bottom portion of the brain, and it really is the powerhouse, and everything for the brain is dependent upon a proper cerebellum. So you're going to put your pinkies out like this. You're going to close your eyes, and I'm going to have Larissa, when over time, touch the tip here to the tip of her finger here. We're going to test both hands. You can open your eyes and drop your hands down. We're going to have you turning your head, and overall we're going to grade these. And then we'll have a basic idea of how the left cerebellum is working and the right cerebellum. Thank you. Hi, this is Dr. Farley. I want to go over with you another component of our testing called the Toronto Clinical Scoring System for Peripheral Neuropathy. We're going to be testing different sensations by using your face and then touching your hands and your feet, and you're going to quantify on a scale of 0 to 10 the difference from your from your face to your hands and from your face to your feet. So we're going to be able to measure these peripheral nerves. The peripheral nerves are really important because they run everything as far as the gastrointestinal system, your heart, your kidneys, and it gives us an idea of the overall nervous system functioning. This takes maybe 5-6 minutes to run through all this, but it's a vital piece of our information to understanding how your overall health is and what's happening with the peripheral nerves. Hi, this is Dr. Farley. We're going to be running a neuromuscular evaluation with our Sigma instrument here. Mainly it's got this little U shape. We come along, we place it on various different areas, and we click, and it tells us how much stiffness is there and what's going on with the brain muscle balance. We're going to get readings of the neck, of the mid-back, and of the low back. Now why do we do this? Because again, these are readings of what's happening with the brain-muscle connection, and we also will be able to see changes in overall tension areas throughout the body, and we can document where you are when you start. If you become a patient and your case qualifies, we start to treat you, we can go back again to look for the changes. So this process will take us maybe 4 to 5 minutes to get this done as well. Thank you.